Welcome to After the Fact. For the Pew Charitable Trusts, I'm Dan LeDuc. This season, we've been focusing on mental health in America, and one of the elements of our conversations has been the intersection of mental health and substance use. Here are two data points. Nearly 1 of every 5 people with a mental illness also has a substance use disorder, and about half of people with substance use disorders also have a mental illness. In this bonus episode to our season, we hear more on this subject and about evidence-based treatment for it from Dr. Rahul Gupta, who leads the Office of National Drug Control Policy, the first physician in that role. Dr. Rahul Gupta, thank you so much for joining us today.
Thanks for having me, Dan.
You are the director of the Office of National Drug Control Policy, so tell us what that office is and what it does.
Congress has given us statutory authority to look over all of the drug control budget, which is about $40 billion across 18 federal agencies. So our job basically is to make sure that we have a strategy, which is the president's strategy, and it's implemented in a way that we can have an impact in reducing substance use, impacting lives, of course, and coordinating the spend of that money across the federal government, as well as impacting resources at state and local levels.
You are the first physician to serve in this office, which has been in existence now for 2 or 3 decades. Your perspective as a physician, how does that aid you in your work?
I have walked the talk, as they say. I've been able to practice for the last 25 years in rural towns, as little as 1,800 people, to large cities as much as 25 million people. It has allowed me to really understand addiction, substance use disorder, and a whole host of public health challenges that informs my work every single day at a time when the need has never been more urgent or more important.
I want to talk about that urgency. Let's talk about what's going on with substance use in America. For the first time, more than 100,000 people died from an overdose in a 12-month period. What's gotten us to that point?
Well, clearly there are several factors. One of those, of course, is that we've had a consistent rise, which really began in early 2000s with prescription opioids and then transformed and transitioned into heroin IV use and then fentanyl. Now we're seeing a transition from plant-based or organics to synthetics, which far more dangerous, lethal. We're seeing the most dynamic drug supply environment in this nation's history. And we've had some situations beyond our control, which is the pandemic, of course, with the rising levels. It has escalated during that time. We've seen isolation. We've seen mental health challenges like never before. All of these things have combined together to create the perfect storm where an American is perishing every 5 minutes around the clock.
We've been speaking this whole season about growing concern about mental health in the country. Let's talk about that connection between mental health and substance use disorders. You've been vocal about half the people, I guess, who suffer from substance use disorders have some sort of co-occurring mental health issue.
It's really important for us to see the connections and understand the connections because we cannot treat one and have success without understanding the other. Earlier this year in the State of the Union, President Biden mentioned the unity agenda, and top of that was both beating the opioid crisis, as he called it, as well as the mental health crisis. These are, as you rightly point out, bidirectionally connected with each other. So it's really important for healthcare providers, for the general public, policymakers, and others to understand that there is this link, and we must work on all of these at the same time.
There's a stigma that can be associated with both substance use disorder and with mental health issues that's not just societal, but also plays out in the medical community. How do we get even the medical professionals to get beyond that?
As someone who's been practicing medicine for 25 years, I've seen that. I've seen this in practice myself. The medical community is not immune to stigma. In fact, if you go back 100 years, we used to have very similar type of stigma with cancer. We have done a lot of work, especially in research and development and understanding stigma around cancer. I think we have hope when it comes to mental health and addiction and substance use disorders. But we have to be clear about this. This is something that not only affects individual societies and communities, but also it affects healthcare the same way. And there are ways to go forward. When we talk about the president's strategy, one of the things we talk about is removing the stigma. It starts everything from language, the way we speak, the words we use, the agencies' names, to all the way to curricula. We want to make sure that addiction medicine is something that is being taught as core curriculum in all health-related professions. So it becomes intrinsically part of that.
It does seem like we're making progress in that area in society. The fact that we're doing a series about this is just indicative of the broadening national conversation. I mean, it's a positive sign.
Yeah, it certainly is. And I'm thrilled about that. Obviously, we're not making progress as quickly as I would have liked to. But I'll give you an example. As former state health commissioner in West Virginia, when I would go into a room full of about 1,000 school teachers and ask, raise your hand if you've been affected or someone you know has been affected, we see almost every hand raised. This is a problem of substance use, addiction, and mental health that doesn't care about people's politics or geography or race or socioeconomic status. It is so pervasive. Everybody is being impacted. And people feel like they need to talk about this, which is a good thing.
If we can get beyond the stigma, let's talk about the actual treatment, which is, as you said, that half of the people with substance use disorder have some sort of concurring mental health issue. How much of a connection is generally happening for patients to treat both those things? Or is there still a disconnect in treatment?
It is not where we like it to be. And I'll give you an example. We know that less than 1 in 10 people with substance use disorders is able to get treatment when they need it. So one of the things we've done in the strategy is to have a goal set for having universal access to treatment by 2025. We believe we have to be moving forward in a faster pace than we've been. We also think that there are opportunities to make sure that people are screened for both of these conditions. It's one of those situations where healthcare systems and providers specifically have to be cognizant and aware that this overlap exists and we have to treat both.
You have this pretty aggressive goal of 2025 to get universal care or access. How do you make that happen in 3 years when we're at 10%?
Dan, you make it happen by looking at exactly the barriers, and that's where the president has said, let's remove the barriers. So today we have these artificial barriers where providers, including physicians, nurse practitioners, and PAs, can easily write a prescription for an opioid, but you cannot write a prescription for medication-assisted treatment when somebody has an addiction. We have to look at addressing those barriers. We also have to make sure that treatment is accessible. And one of the things that's been happening, which I'm really happy to talk about, is during this pandemic, we've expanded the ability to access treatment to telehealth, phone consultation, and making sure that people can take home their methadone or their treatment, make sure that there are mobile vans that will provide access for methadone in rural areas, underserved areas, in communities of colors, in jails and prisons. The way we're going to get there is to make sure communities rise up and are aware that treatment exists, and we've got to get people the help when and where they need it without fear or judgment.
Are there issues at all about prescribing medications for substance use disorders, but also when you're dealing with these co-occurring issues that people might have? They might have depression or anxiety, which a physician might think about recommending medications for those issues. How hard is that to create a treatment plan for?
It's important that we get the training in health-related professions for both mental health conditions as well as for substance use and addiction. And why that's important is the first step is screening individuals for these conditions. Only when we can screen appropriately can we diagnose it or detect it. Once you detect it, then you have to be proficient in being able to prescribe and give that treatment. That may be prescriptions, also maybe counseling and other additional services. So it's not hard if you're appropriately trained and you know what you're looking for. It's terribly difficult when there's either stigma or you're not appropriately trained or you don't want to get trained. And that's what we're trying to change inherently.
Is screening for these issues part of our regular procedures now? We can go in and have our annual checkup. We can go in because something else hurts. And in good medical practices, doctors ask good screening questions. How prevalent and how much a part of the regular routine is screening for substance use disorders and other mental health issues?
Unfortunately, not sufficient enough. I think we can do a better job of screening individuals for these conditions, especially from a primary care perspective. I think we could be effective in capturing diseases, especially mental health and addiction substance use disorders early, because we know when we do that, the outcomes tend to be better because they can get the help earlier. As a physician, also as a public health officer, I've seen that where even when people have non-fatal overdoses, that information often does not make it to their primary care provider. So it's really important that we use the tools we have to be able to communicate within systems and across systems to help people. But it begins with that first screening questionnaire that allows providers to know both the physical health, but also the mental health. And I think there's more we can do on that.
You've talked about harm reduction. What do you mean by that, and how do we do it better? Because harm reduction on the face of it sounds great.
Yeah. Dan, harm reduction is about meeting people where they are, developing trust and engagement. We know that harm reduction approaches have known to save lives. They're cost efficient, and they connect people to treatment. Now, for the first time, in our policies as federal government, we've included specific harm reduction policies as part of the solution. That is 3 areas. One is naloxone. Naloxone is an antidote for opioid overdose. That's important because 3 out of 4 people are dying because of opioids overdoses. It tells us that we don't have sufficient naloxone available in communities. So that's a really important piece and a measure that will save tens of thousands of lives. Second is fentanyl drug strip checking. That's the ability for people to know in their drug supply if this deadly and dangerous drug called fentanyl is present and take appropriate action. And the third is something called syringe service programs, where we, for people who use IV drugs, make sure that they're able to have syringes access as well as for needles that prevents the spread of communicable diseases, which are oftentimes expensive, fatal, dangerous, like HIV, like hepatitis.
Some of those things can be controversial in some communities. What's the medical argument on their behalf?
I think the best medical and evidence-based argument is that these are data-driven approaches that have known to work. There's sufficient evidence behind them. They are cost-effective. They have bipartisan support. And at the end of the day, they're working to save lives and connect people to treatment while preventing some of these communicable diseases. The old days, you get people to come to your doctor's office, the 4 walls of the hospital. Not everybody's going to show up there. And we've known from the pandemic onwards that we need to meet people where they are. This is the way of the 21st century new healthcare, whether it's telemedicine or harm reduction services.
You mentioned the pandemic. Let's talk a little bit about the influence it's had over the last several years. It's transformed our lives, and it's made a lot of bad things worse. What's been the effect of the pandemic on substance use disorder rates and other issues involving mental health?
We know certainly that the substance use disorder, especially overdose rates, were going up prior to the pandemic. They have significantly worsened during the pandemic. There's a lot of factors. Social isolation is one of those factors. That's also true for mental health conditions. We also know that earlier there was a shutdown of a lot of these services and clinics. The access to care has been a problem. But the good news is that we recognize that, and a lot of the actions that have happened during the emergency phase of the pandemic has now allowed us to not only have those countermeasures, but also be able to test the efficiency and effectiveness of those countermeasures. So now we know what works, and it's an important time to recognize both mental health as well as substance use disorders and addictions impact and take those steps necessary to be able to mitigate some of those challenges.
I was hoping maybe to, as we conclude here, to talk about the role of mental health in our overall health. People, I think, have a tendency to say, hey, I'm feeling pretty good today. They generally mean no aches and pains and got up without any stiffness. And if they wake up and feeling, it's a tough day, I can't get to work today, I'm not sure they always necessarily think of that as an illness or something to be concerned about. What is the connection between our mental health and our overall health?
Yeah, so I think, Dan, over the time, one of the things we've done, unfortunately successful as a nation, is figured out a way to separate the head from the body. And I think it's really important, and no time more important than now, to understand that it is all linked. When you're not doing well from a mental health standpoint, I think our performance and physical activities and everything is impacted as well. So one of the things we have to do is incorporate that back in, understand the mental wellness, well-being dictates not just who we are, how we perceive the world, but also how people perceive us and our ability to make whatever we're doing in our social life, personal or professional life, to be able to function well. But also our policies are not very dissimilar from that approach, meaning we have a challenge with parity today. If you think about it, that far too many Americans, they're not able to get the same level of coverage for mental health as they do for physical health. And that's, again, work in progress that we must make sure that whether it's parity, whether it's access to mental health services, the availability of mental health services, including the workforce challenge, we need to be there and we need to be working towards that. Only then I think we're going to be able to have and address the mental health of Americans across the nation.
So as you look forward, say in the next, 5 to 10 years, just as someone who lives and works this, what are going to be the signs you look for to show progress?
I think one of the hard numbers we'll have to make sure that we're making progress on is obviously both the fatal overdoses and non-fatal overdoses. We don't even have a good number and calculations of non-fatal overdoses across the nation, and we're trying to build a system for that. I think making sure that people have the availability and ability to access affordable mental health and substance use disorder services across the nation. Where you live, meaning your zip code, should not define whether you get the services when you need them or not. We want to eliminate those barriers.
By the nature of this work, it seems you have to be an optimist, right? So what gives you hope that things will get better?
I think we have the ability to persevere. We have the ability to improve ourselves. And I think the president has said it best that we're going to get the resources to communities that need them, and we can beat this. And we're going to see improvements in both mental health, substance use disorders for a lot of reasons, including the work of professionals at local and state levels, private sector, law enforcement, and others that are working every single day to make an impact.
Thanks for listening. To learn more about our full season on mental health in America, please visit pewtrust.org/afterthefact. I'm Dan LeDuc, and this is After the Fact from the Pew Charitable Trusts.